Your doctor has told you that you need to be induced, and suddenly you are wondering, why can't I just wait for labor to start naturally? Is induction safe? Is it not so painful? And what exactly are they going to do for me? Hi everyone, you're welcome to my channel again, and this is your favorite midwife, Olusolape. And today we want to go through induction of labor and augmentation of labor. And you know, as we normally do on our page, we break health issues, health topics down to your language. We interpret it in the language you will understand. So if you are in this shoe, are you pregnant or you are yet to be pregnant, you need to understand this topic, augmentation and induction of labor. Sit back as we make it simple, and you will definitely love this session. Now, what is induction of labor? Induction of labor, in simple terms, simply means starting a labor, initiating a labor that has refused to start by itself, that has refused to start on its own, labor that has refused to start spontaneously after 40 weeks of pregnancy. Induction simply means we, as the medical personnel, is trying to make you fall in labor that has refused to start, meaning we are the one initiating that labor. You are 40 weeks already, or you're already approaching your 40 weeks, and your doctor told you, we are going to induce you. What it means is that your labor has refused to start. You are not contracting at all. We are the one that is starting that labor. This process that I just explained in simple terms will require some injections, medication, and some processes by your medical personnel to help you initiate labor, which will definitely be explained to you by your doctor and your nurses. But I'm going to try as much as possible in this video to break it down for you so that you can understand the nitty-gritty of induction and augmentation of labor. Now, before we proceed, your doctor might as well advise you for induction even before your 40 weeks, depending on your doctor's assessment. If that pregnancy is already posing a threat to you, your doctor might want to advise that this baby needs to come out. And like I said, you are not contracting. It's your doctor that will give you some injections, some medication that will actually make you to fall in labor. I am pointing this out again so that you can know that according to your doctor's advice, you can actually be induced before 40 weeks if that pregnancy already poses a threat to you, or your doctor has every reason medically to terminate the ongoing of that pregnancy. It is expedient for you to understand that before induction of labor is commenced, like I said, your medical personnel are the one planning you for induction, meaning we are going to give you a date and time that the procedure will be carried out. And there is a particular test or assessment that will be done before your induction of labor commences, like NST, non-stress test. This test is to let us know if your baby can actually go through the process of induction or not. But like I said, there are so many things that can be used for induction of labor depending on what your doctor wants to do. There are medications that can be inserted into your V area, that can be put under your tongue. There are medications that can be infused in IV fluid that will be put up, or your membranes can be ruptured. All of this criteria is according to your gynecologist's discretion. So if you have been booked for induction of labor, please, I will advise you in this video to listen keenly to your medical personnel and ask pertinent questions about induction of labor so that all fear and anxiety can be duly allayed before the commencement of this procedure. That you are induced does not categorically mean that you are going to deliver that baby by yourself. Remember, induction is a process we initiated, and there is a stipulated hours that you can stay in labor. And if your doctors and your nurses, everything managing you, sees that the labor is not going as planned, my darling, you can actually be booked for an emergency cesarean section. I am explaining this again so that you can know that your induction does not automatically mean that you are going to deliver that baby by yourself. But not all induction will eventually lead to cesarean section, but some can eventually lead to cesarean section if your induction procedure or process does not actually go according to protocol. Your doctor will definitely advise emergency cesarean section. If that been the case for you, please accept and do not delay further, because if you do that, complication might set in that can actually push you or your baby's life at danger. Now, let's talk about augmentation of labor. What do we mean by augmentation of labor? Augmentation of labor simply means trying to push more effort into a labor that has started already. Augmentation means this labor has started by itself spontaneously. You have started to contract, but your medical personnel, your doctors and your nurses, sees that you are not having the strong contraction that is strong enough to push your baby out. We want to augment, we want to add, we want to increase, we want to intensify the labor. We want to add more to your contractions so that the time with which you will be in labor will not be too prolonged. This is at the discretion of your medical personnel. If your labor have started, if you're watching me in this video and you are still pregnant or you are advancing to 40 weeks, have it at the back of your mind that your doctor and your midwife can advise augmentation during your labor if they have assessed that your labor is not going as it should. My darling, you have to accept this procedure. And what will be used is known as oxytocin agent that can be put up in your fluid. Let me quickly advise you before I forget. That fluid that is put up to augment you, do not touch it. Any fluid that is put up for you during labor, do not adjust, do not slow it down, and do not increase the rate, because the rate at which is being titrated is according to a specific protocol that it will be followed as you are contracting. If you are being induced or you are being augmented, the main aim is a live mother and a live baby. Listen to every instructions during the process of your induction and your augmentation of labor. And before we end this session, always lie on your left side more during labor so that enough oxygen can get to your baby, and follow every of the instructions given by your medical personnel during this induction and augmentation process. I wish you all a safe delivery. I remain your humbleness, Olusolape, and I will see you all again in my next video. If you are yet to subscribe to this our page, this our channel, do well to turn on your notification button, subscribe, so that you will be the first to know when we drop another video. Thank you and bye-bye.